Kristen Isajan. I'm the clinic director at Platinum Chiropractic, where we have a unique focus in neurostructural correction. So we at our practice, we're on a mission. We're on a mission to help the community get and stay healthy with our natural chiropractic care. When we look around, we really see a lot of people suffering needlessly, not realizing that they have options when it comes to their health care. I'm here to let you know that you do, in fact, have options. So today I'm going to go through a brief overview of chiropractic, what it is generally, and then speak more specifically about what we do at Platinum. So who here has seen a chiropractor before? Anybody? Awesome. Full room. That's great. That's not always what we see. So for a general definition of conventional chiropractic, just like all dentists work with the mouth, all chiropractors work with the spine, but their focus and philosophy might differ, right? So conventional chiropractic describes virtually all of the chiropractors that you're going to find in the area. And their objectives are to decrease muscle spasm, increase your range of motion, and reduce your pain. They'll do this with general manipulation, and they may also include physical therapy modalities like ice and heat or electrical stimulation. And they'll do focus on your specific symptom, and then when those symptoms return, they'll say come back, and we'll readdress that with the same process. They're very good at this, but what we do at Platinum is different. So unlike conventional chiropractic, we focus on neurostructural correction by utilizing objective measures to find the underlying cause of your health condition. And when we're saying neuro, we're talking about your brain and your spinal cord, so your central nervous system. And when we talk about structure, we're talking about the bones that house and protect that delicate system. So that's going to be your skull and your spine. This approach allows us to not only provide relief from immediate physical concerns, but also address the underlying cause of those health concerns. So, do you guys know what controls all of the functions in your body? Give you a guess. It's your brain, right? Your brain is self-healing and self-regulating through your brain and nervous system. Sorry, your body is. Your brain is constantly sending signals, so down through your spinal cord, out through all your fingers and toes, to all of your cells, all your tissues, and your organs. And then the signal comes back up to your brain, and that's the constant communication loop that you should be having. However, when the spine shifts out of alignment due to either physical, chemical, or emotional stress, it can obstruct that nerve communication. We call this a neurostructural shift, and it's often the underlying cause of many symptoms that people have been experiencing, and we actually call those secondary conditions because they're secondary to the primary shift that you have happening. So we all know what normal body temperature is, right? 98.6 degrees Fahrenheit. We have to establish normal eyesight. We have to establish what normal is so that we know what normal eyesight is, what high blood pressure is, all of those things. And it's no different when we're talking about spinal alignment. There is, in fact, a normal. Walking around with a neurostructural shift is no different from driving around a vehicle with a frame that's badly in need of an alignment. That stress is going to put more stress on the frame of the car. If regions of your body have been shifted or displaced, either gradually or due to injuries, it's going to put abnormal stress on the underlying neurostructure, including your ligaments, your joints, your tendons, your intervertebral discs, your muscles, and your nerves. These abnormalities will result in deterioration, degeneration, and discomfort. You can think of it like the foundation of a house. This is an analogy that we use often. If one part of your house foundation starts to sink a couple inches, you'll notice things like the floorboards creaking, the drywall cracking, and the windows not going up and down as well anymore, right? A conventional repair person will come in and they'll just put a nail in the floorboard, they'll spackle the cracks in the wall, they'll put WD-40 on the windows. But they're not addressing the underlying concern, they're not actually fixing the foundation. And unless you fix what's happening in the foundation, those problems are just going to continue to repeat, right? So when a neurostructural shift is present, it can show up differently depending where it's located in your spine. We'll start from the top and work our way down. So you have the nerves that come out here from your upper cervical region. They come out and they actually come around your head to the front of your face. And they're going to control things like your eyes, your jaw, your ears, and swallowing. So people will show up to the practice with things like headaches, TMJ, eye pain, or trouble sleeping. As we move down the neck to the lower cervical, these nerves come out around your shoulder, and they're going to come down to your elbow and wrist. And so we might see things like carpal tunnel, wrist issues, elbow concerns, shoulder pain, or neck pain. And all of these issues in other practices might be addressed individually, right? They're going to come in and they're going to take a look at your shoulder. That's your elbow. Take a look at your shoulder, your elbow. But those issues aren't really going to get resolved because it's actually more of a central issue with your spine and the nerve communication coming out. Next up, we have the thoracic spine. So think upper back to mid back, right around your ribs. And so these nerves are coming out and around to your chest and rib area. Think about heart, lungs, and also your digestive system. But what people will actually feel are things like knots in your upper back, chest pain, rib issues, and digestive problems. And then we have the lumbar spine. So lumbar and sacral area is going to be in the low back. And so that comes out low back, reproductive centers, and then back down through our glute, knee, and foot. And think of things like sciatica, knee pain, numbness and tingling in the toes, and then also hormonal issues. Everything runs through your neurostructure, and if there are any obstructions to that communication, then your body's not going to function well, and things will start popping up. So we need to figure out if you, in fact, have a neurostructural shift. And how do we do that? We do an examination. We do very in-depth examinations in our practice. We include structural photography. This allows us to see if you have any deviation in your pelvis, your shoulders, or your head, and also if you have a weight imbalance from one side to the other because you're compensating. We do 3 different types of nerve scans, including heart rate variability, to identify if you have any kind of nerve obstruction or stress in your nervous system. And then we also do functional x-rays. So we take a look at the bones and joints, see if you have any spinal degeneration, any other bone and joint issues, or anything else that could complicate the case, because we want to make sure that everything is safe. Common solutions to these types of problems usually include physical therapy, medication, injections, or surgery. But none of these really address the structural and neurological components to the body. They're more symptom management. Our solution is to first identify if and then where you have a neurostructural shift, correct it through specific neurostructural chiropractic adjustments, support these adjustments with rehab and lifestyle changes, and then we're going to track your progress with both subjective and objective measures as we move through care. When we correct the structure, the entire body functions better, right? For example, we had a patient who came in with migraines. Once we corrected the neurostructural shift in their upper cervical, not only did their migraines reduce, but also their shoulder pain went away, and then they began to sleep better as well. Which one? I was like, I hope we're going for the left, yeah. When we make the initial correction, then we can see all kinds of other things change. We see this not only, that was an example of migraines, but we've seen it in a broad range of other things as well. People are coming in for low back pain, and then it ends up that their menstrual cycles improve as well, because when the nerves can properly communicate, all kinds of things can happen. Your body can heal properly. And that's the power of restoring normal function. Each care plan is customized based on the needs of the patient and the examination results. And so they include specific neurostructural chiropractic adjustments, rehabilitation exercises, lifestyle modifications such as changes to your ergonomic setup, nutrition advice, as well as sleep, and then regular re-exams to track your progress. Once we have corrected the initial concern, we also offer wellness, or what we call protection plans, to keep the spine from shifting and recreating the problems that you came in with. Because the biggest predictor of an injury is a previous injury, right? Our goal is to get you healthy and keep you healthy so you can live your best life and optimize your health for the future. Similarly, we see patients of all ages, including kids, working professionals, and athletes, on a preventative basis. And this is because when the nervous system is functioning well, you have a better chance of adapting to stress, injuries, and life in general. By now, you've probably thought of somebody in your life who has a health concern that we might be able to help with. In that case, now or in the future, we would love for Platinum to come up as a possible solution. And so that's why we offer complimentary consultations. This way you can come in, you can speak with Dr. Caro directly. He can go over what you have going on and how we can help. Thank you very much.